We all know about rehabilitation, but what I wanted to talk to you briefly about today is prehabilitation or prehab. That's a method of getting patients in the best possible shape, both physically and psychologically. It's about a tailored prescription for each patient so that they can get the psychological, nutritional and physical exercise support so that they get the best possible outcomes from their surgery.
At Maggie's, we have taken the approach of universal prehab, so there's no referral needed. It's a service that we offer weekly, and it really helps to look at all three elements of prehab.
There's a lot about having a cancer diagnosis and treatment where the control is taken away from you. You kind of hand over a lot to the medical professionals in your team, whereas we think with emotional well-being, diet and exercise, they're things that you can do for yourself. And we also know that if people feel that they are doing things for themselves, if some aspects of their well-being are within their control, that can really help with their treatment and with their outcomes. You also need to think about how you can begin to understand when something is a normal response to the situation you're in, and when you might be slipping into something a little bit more unhelpful. Naturally, as they go through treatment, there can be things that are emotionally challenging for them, and what we're doing with prehab is straight away speaking to that. You do have a choice to pause and respond to these thoughts in a different way, and we give some practical techniques and ways of managing feelings of overwhelm and anxiety.
Often there's a real isolation that comes with a diagnosis, and Maggie's offers an opportunity to meet people in a similar situation.
I was told I had lung cancer. I was offered a robotic keyhole surgery, but I wasn't fit enough to be able to go through that operation. Then my oncologist told me about the prehab team. They are an amazing team of people. They explained what they expected of me, really pushed me.
Rest now. It's good. Feels okay. Sam was going to undergo chemotherapy treatment prior to surgery. Our job was to maintain or improve her fitness during that treatment period so that then she would go into the surgery in as strong a condition as possible. That's it, bang on there, just hold that. With Sam, the most effective thing that we could do was a style of interval training. 30 seconds work when you're ready. Doing it in a safe and controlled way, we know that's probably the most effective way to get her fitter quite quickly.
I think historically people think if you've got cancer and you're having a cancer treatment, you're inevitably going to lose weight and you're going to be nauseous and you're going to lose your fitness. And actually what we know from the published literature and patient experience is that actually exercising during this period can help reduce those risks. So if we can build muscle bulk, you can actually put on weight. It can help reduce cancer-related fatigue, nausea and vomiting, the peripheral neuropathy.
And we know that if they're stronger generally, then they're going to be able to move around better after the surgery, and again their recovery gets better.
I didn't realise I would enjoy it as much as I did.
4, 3.
They didn't just get my body strong, they kept my head strong.
This time I think we can go as hard as you can. Push it. 3, 2.
Thanks to prehab, I was able to have surgery, and I could never thank them enough for that.
Such an uncertain time for patients, and they can really struggle with their eating and drinking. So it's really important to have dietetic input early on so that we can get on top of things and maintain their nutritional status before they start their treatment. I do some nutritional assessments, take anthropometric measurements, interpret blood biochemistry, and also calculate their nutritional requirements to do universal, targeted or specialist interventions with them.
I had cancer of the esophagus. It began to make me feel unable to eat properly because I was sick straight away. You just wondered what you were surviving on, particularly as the weight was dropping away. The dietitian was in constant contact to try and maintain my weight. He also introduced me onto a liquid supplement.
We communicate very regularly with the clinical nurse specialist and the oncologist just to make sure that everybody is aware of where the patient is in terms of their journey.
You can't just stop eating. You've got to have some inner body strength to deal with the physical things that are going to happen to you. And then on the other side of it, you've got to have the mental strength.
Sometimes we don't always talk to other people, friends and family, because we're trying to protect them. So talking to someone that's not a family member, and that can help relieve anxieties just by sharing. I would do a psychological assessment questionnaire, and we have a psychology team, a counselling service, and we have a talk and therapy service that we can refer you on if you felt that you needed that extra support.
So this particular programme that we've set up here, we've managed to get a contract with Better Gyms, and we offer 3 gym sessions a week. Your clinical nurse specialist would make the referral to our prehab service.
When I was referred, I thought it was brilliant. You know, rather than me sitting at home or pondering and worrying about my treatment, I get an opportunity to release the stress. So this is helping me mentally and physically.
It's all individualised to the patient needs, according to their condition as well and what they can manage.
For my condition, I need to build muscle strength to cope with bone density loss. The fitter you are, the better chances you've got of fighting this. I feel good when I've been here. I meet people who are on the same track, and it just makes you feel good.
You get your body stronger. It releases endorphin, and it's a nice habit for the future.
Yeah, I got back a lot of what I thought I'd lost.
The stats have shown that Prehab has shown an improvement in their heart rate, in their blood pressure, sit to stand, hand grip strength.
In North East London, we have a diverse, disadvantaged population, so we need every intervention possible to give them the best chance of success.
A lot of our patients who are diagnosed with cancer, they carry on working. If we were to have more funding, we could offer sessions after work. So there's so much more scope for developing it even further and reaching more people.
North East London Cancer Alliance has funded Prehabilitation, and we've shown that it reduces length of stay, it improves outcomes for patients. So I'd really urge all clinicians involved in cancer treatment to get behind the Prehabilitation programme and make sure that it's being offered to all their patients.